Hello everyone, I'm Mmalang and I'm going to discuss the factors surrounding illness under my health psychology subject. Okay, let's start with the first one, the acculturation. So, what's the role of acculturation? Let's define first what is acculturation. It is the process by which a newcomer adapts the cultural behaviors common in other communities or countries or ethnicities. So, this process has a major impact on the long-term healthcare system and health behaviors of people, and this may lead to changes in diet, physical activity level, health-seeking behaviors, and more. And according to studies, acculturation has been associated with significant changes in health behavior. And it is an important variable in health psychology and behavioral medicine. So what are the examples of acculturation in terms of healthcare system? For example, we can choose to adopt between a modern medicine from Western, or we can adapt the acupuncture medicine from China. Or you can choose if you want to pay a visit with a doctor or pay a visit with a herbolarios or albulario. So it depends on the cultures, on the beliefs, and sometimes we adapt the culture of others, and this is what we call acculturation. Okay. So next factor that surrounds illness the is the recognizing symptoms. Okay, we have different ways and we have different reactions and behaviors in recognizing symptoms. So the first one is the confirmation bias. So what is confirmation bias? Once we believe something is true, we often change the way we interpret new information and the way we look at the world because of that belief, of our beliefs, no? And we try to confirm our beliefs and have a bias in how we process information. So that's why it was called confirmation bias. So social psychologists have shown that if there is any ambiguity in a person's behavior, people are likely to interpret what they see in a way that is consistent with their bias. No? So if we believe that a change in our bodies is not a symptom of illness, we will probably look for information to support that belief and find it. So for example is you started to have skin allergies, and you will probably look for information that it is just an allergy caused by what you eat, okay, rather than considering the symptoms of other skin diseases, because you believe that if you have skin rashes, it is an allergy. Okay, so another example, if a person's persistent feeling of tiredness, um, he might consider this as an effect of his sleep deprivation. So that's his belief. And he might disregard the symptoms of other chronic diseases like diabetes or anemia. Okay, so there are different examples of confirmation bias. The first one is not seeking out objective facts, because you stay with your belief and you find facts based on your beliefs. Next is interpreting information to support your existing belief, only remembering details that uphold your belief and ignoring information that changes your belief. So that is the confirmation bias. Okay, another under recognizing symptoms is the attributions. Okay, attribution is the cognitive process of assigning meaning to a symptom or behavior that is then we make attributions, no, assigning meaning to a symptom or behavior. So, aside from confirmation bias, another social psychological process that can influence our recognition of symptoms is how we determine the cause of events. Okay. The cognitive process of assigning meaning to a symptom is like, for example, if your stomach hurts, you may attribute the pain to what you just ate. And you are more likely to worry about a stomach pain than if you have just tried something that is very different. Okay. Or, for example, how you attribute a pain in your chest may depend on physical factors. Okay. For example, age. Okay. A teenager may be likely to think of a chest pain as or a stomach pain as a cramp or gas, while an older person may worry about a internal um, internal organs diseases, or if the person is experiencing chest pain, he might worry about a heart attack. Okay, so the cause to which we attribute these symptoms can influence whether we seek treatment or not. Okay, so that is the attribution. If we have attribution, we also have the misattributions. And misattributions, sometimes we mistakenly label our physiological experiences based on external factors. Okay. For example, if you feel tired and there are several people at work with colds, you are likely to misattribute your tiredness to your developing a cold, when it could be due to your not getting enough sleep. So this misattribution can increase your anxiety, and in combination with a confirmation bias, okay, misattribution plus confirmation bias, you may soon find yourself accumulating more evidences to support your theory. Okay, so in the end, your belief that you are getting sick will make you really sick. Okay, and that's what we call the self-fulfilling prophecy. Such self-fulfilling prophecies can contribute also to on how we look for medicines and treatments. Okay, and I'm going to discuss that later. Okay. Okay. Another is the personality. No? Of course, personality has something to do on how we recognize symptoms, and it plays a very critical role in healthcare. I have here four examples of personality. For example, the high anxiety. Um, Actually, studies have shown that people who are relatively high in anxiety tend to report more symptoms of illness than others do. And those person that are high in neuroticism is they have the tendency to become oversensitive and to complain more about ill health. Okay. Another is hypochondriacs. People who monitor their symptoms to an extreme may become hypochondriac. So, hypochondriasis or hypochondria is a psychological disorder characterized by excessive preoccupation with one's health and constant worry. So, hypochondriacs believe that any minor change in their condition could be a sign of a major problem, and they are constantly going to physicians to be checked. And even when they are told that they are fine and all right, they do not believe the diagnosis and may change doctors. Okay, they will keep on visiting other doctors. Lastly is the low conscientiousness. Okay, so individuals who are less responsible and less self-controlled tend to report poorer health, and they tend to become more overweight. So that's under the personality, under recognizing symptoms. Okay, now let's proceed to seeking treatment. Of course, once you recognize that you have a problem, you have to decide to seek treatment. Who do you go to? Where? How? Okay, so there are three overlapping healthcare systems: the lay sector, the folk sector, and the professional. So if you want to seek treatment, you can choose among the three. For example, the lay sector. It could be it involves culturally based personal and familial beliefs and practices. For example, your family, you belong to a Chinese family, of course, your traditions and rituals could be your first choice in seeking treatment. Okay. Or you can also choose the folk sector, and it involves cultural traditions and specialties. For example, a shaman, faith healer, herbolarios. Okay, that's under folk sector. And the third one is the professional sector, which involves the doctors, the clinicians, like the Western medical system. So that's under the professional sector. Okay. Okay, now we have the role of culture under the seeking treatment. Of course, culture plays a huge role in medical interactions, and it influences how an individual might view an illness or treatment. Okay. For example, you can choose whether you will have your treatment under Western medicine or versus traditional medicine. For example, Western medicine, you will go to a hospital and visit a doctor. If traditional medicine, you might engage into shaman, faith healers, or herbal or acupuncture. So that's under the traditional medicine. Or you may seek treatment based on your superstitious beliefs about your sickness. Okay? For example, you believe that you have a stomach cramp, and in Filipino we call this, or in Visaya we call this panuhot. Okay? So you have the tendency to self-diagnose, and after self-diagnosing, you will have also the tendency to self-medicate. Okay. Next is family influence. Of course, in seeking treatment, um, family has a vital role, like having their support in decision making, where to seek treatment, or how, or if you're going to seek treatment. Okay. And lastly is the behaviors, or behaviors. For example, instead of seeking treatment because you are a fatalist or fatalistic, it's a view that illness and suffering are unavoidable and predestined by the will of God. So family members and even doctors should not interfere. So the tendency is you will not seek treatment because of that, because of your fatalistic resignation. Okay, so that's the role of culture in seeking treatment. Okay, another is understanding delays under seeking treatment. Okay, people sometimes take a lot of time to recognize they have symptoms, and this is appraisal delay. Okay, appraisal delay can lead to illness delay because the time between the recognition that one is ill and the decision to seek care. And sometimes the delay in seeking treatment results from the symptoms of a problem being misattributed. Okay, for example, many heart attack patients do not immediately call an ambulance or a doctor for assistance because they believe the pains they are experiencing may be due to other reasons, or it is just a less serious problem such as indigestion or flu and are not potential fatal. At other times, a delay is due to concern over not having enough money or insurance. So the seeking treatment behavior is also affected by the financial status of the patient. Okay, so actually these two pictures are my examples, but I have already discussed it with the previous slide. Okay. Okay, another under the seeking treatment is the hospital setting. Okay, of course, staying in a hospital is somewhat scary, and you have to put your life in the hands of hospital and its medical staff. No? So you have to be very careful in choosing the hospital. And this one study found out that not all hospitals provide the same level of care. There are many factors that impact patient outcomes, and these include experience and training of doctors, okay, volume of cases for a particular condition, culture of the hospital, or modernity of the machinery or the technology of the hospital. For example, if your medical concern is about your heart problem, of course, instead of choosing lung center, you will choose the heart center hospital. Or with regards with the volume of cases for a particular condition, during the pandemic, we have observed that people are afraid to go into the hospital because of congestion. So instead of seeking treatment in the hospital, they tend to stay at home. Okay, so that could be one of the factors that patient considers. And of course, the patients are also looking at the modernity or the equipment of the hospital, if they can provide proper medical treatment. Okay. Okay, next is under seeking treatment is staff relations. Okay, health psychologists have begun to pay attention to another level of interaction in hospital. So before, between a doctor and a patient, but now they are looking at staff relationships also. So not only are patients culturally diverse, but also hospital staffs are also diverse. So I have here one example. Why Filipino nurses are always high in demand, especially abroad. Because according to one of the studies, Filipino nurses are hardworking, have a neutral accent which is responsible for language and communication, considerate, patient, respectful, strong sense of spiritual faith and their culture, and Filipino nurses are entertaining, could be under personality. So, workplace diversity is becoming increasingly important in the healthcare settings. And as the workforce and demographic patterns change, it is important for the hospital also to understand and influence the staff with different values, beliefs, and expectations of different cultures. Because if there are misunderstandings and misinterpretations with regards to cultural differences in the hospital, it will result in an increase of absenteeism, decreased staff satisfaction, and decreased quality patient care. Of course, patients want to feel safe and comfortable. So they will choose a hospital with a good staff relations. Okay. Next, adhere to treatment. Of course, once the patient and the practitioner interact and a diagnosis is made, the patient has to follow the doctor's prescription and recommendations. Okay, so this is what we call adherence. Okay, there are many practical concerns that influence adherence. I want to cite one of the studies. They found out that 33% of patients do not adhere to prescriptions for acute illnesses, no? Because acute illnesses are somewhat minor illnesses. So they will just self-medicate and they will not adhere to prescriptions. And 55% of patients do not adhere to treatments for chronic illnesses. And this is alarming because chronic illnesses are lifelong diseases, no? And it needs maintenance. So patients with chronic illnesses should and must adhere to treatment. Okay. So what are the factors that influence adherence or non-adherence? Okay. For example, we have here fear. Okay. Patients may be frightened of potential side effects. They may have also experienced previous side effects with the same or similar medicine or prescription. And sometimes, if the patient was able to witness side effects experienced by a friend or a family who is also taking the same medication, it might lead them to believe that the medication could cause side effects and problems. So they have this fear. Another is the cost. A major barrier to adherence is, of course, the cost of the medicine prescribed to the patient. The high cost may lead to patients not filling their medications in the first place, or they may even ration what they do in order to extend their supply. So they will cut, no, or minimize the supply of the prescription, or they will not follow the exact amount or exact number of the medicines. Okay. Next is too many medications. When a patient has several different medicines prescribed with higher dosing frequency, there are chances that they are not adhere to the treatment. Okay. Another factor is misunderstanding. So, non-adherence can also happen when a patient does not understand the need for the medicine, the nature of side effects, or the time it takes to see the result. So, this is especially for patients with chronic illness, no? Taking a medication every day to reduce the risk of something bad can be confusing. Another is lack of symptoms. So, this falls under confirmation bias and attribution. Okay, they do not believe that they have sickness and they attribute this with something not too serious, so they will not adhere to the treatment. Okay, and last is mistrust. Okay, under mistrust, it's about prescribing medicines become a money-making business. So the tendency is the patients will not trust the doctor because the patient might think that the doctor just wants to earn money from prescribing medicine or treatment. So that's under mistrust. Okay, another factor is the patient-practitioner interaction. Okay, between the doctor and the patient. Good communication between the doctor and the patient is integral to patient adherence to a treatment plan. Okay, unfortunately, many doctors, which I also observed, rush. No, they had this tendency to rush to meet a certain number of patients. Okay. What are the factors under the patient-practitioner interaction? First is the communication. Okay. Patient outcomes depend on successful communication. The physician who encourages open communication may obtain more complete information, enhance the prospect of a more accurate diagnosis, and facilitate appropriate treatment plan or counseling. Okay, and communication between the patient and the doctor is very important. Okay. Another under patient practitioner interaction is this cultural stereotyping. So, stereotyping patients according to their age, race, weight, socioeconomic status, gender, other factors can have negative impacts on their health according to research. Okay, so it is very important not to stereotype or generalize. Actually, stereotyping is somewhat like a stigma, no, in the healthcare system. And I have here some example of stereotyping in the healthcare system. Okay, my first example is a belief from a doctor. He said that Black patients won't comply with my instructions about taking this medicine or they won't be able to afford it. So there's no point in prescribing the medicine. So the doctor is stereotyping in this example, no? He is generalizing Black patients. So for him, Black patients do not follow instructions and Black patients cannot afford to buy medicines. So this could affect the patient practitioner interaction. The Black patients might not come back again to that doctor. Another example is in one study of white medical students, it was revealed that half of these students believe that Black people feel pain less because their skin is thicker, their nerve endings are less sensitive, or their blood coagulates faster, and that Black people had very hard skulls, thus could handle blows to the head. Okay. So this is also another type of stereotyping. So basically stereotyping, like what I've said, is based on cultural factors like ethnicity, race, gender, okay, socioeconomic status, and more. So stereotyping can affect the patient and practitioner interaction. So how can we solve stereotyping? No? So we have the cultural competency. Cultural competence is as important to the outcomes of the patients. Every step of the care process, from getting an accurate medical history to developing a treatment plan that the patient understands, requires trust and a good relationship between the provider and the patient. And that is completely dependent on the cultural competence of the provider. Okay. So we have the cultural awareness and cultural sensitivity. Cultural awareness in an appreciation of the external or material signs of diversity, such as the arts, music, dress, food, religious activities, or physical characteristic. Whereas cultural sensitivity is the personal attitudes and includes not saying or doing things that might be offensive to someone from a different cultural or ethnic background. So combining these two, we have the cultural competence. Cultural competence is defined as using a combination of culturally appropriate attitudes, knowledge, and skills that facilitate providing effective healthcare for diverse individuals, families, groups, and community. Okay. So thank you everyone for listening and have a good day. Thank you.